This is the overview of the mind map we will be discussing today. We will be going through them one by one.
Protein synthesis is a cells that synthesize new proteins in ribosomes. Protein synthesis is essential for living cells, as cells needs to synthesize new proteins in ribosomes. Next, let's discuss about protein synthesis inhibitors, which is a substance that prevents the growth or proliferation of cells by interfering with processes that directly result in the production of new proteins. There are several types of protein synthesis inhibitors, which is tetracyclines, aminoglycosides, macrolides, chloramphenicol, and clindamycin. Each types carry different functions and benefits in our body. Other than that, there are other several protein synthesis inhibitors that we will not be discussing in our video, which is fusidic acid, quinupristin, and linezolid.
The first protein synthesis inhibitor drug is tetracyclines. Tetracyclines are isolated from Streptomyces bacteria. It has 4 fused cycline rings with a system of conjugated, double bonds. It effective against gram-negative and gram-positive bacteria. The 4 common drugs of tetracyclines are tetracycline, minocycline, doxycycline and demaclocycline. Giving tetracycline with drugs such as barbiturates, phenytoin, carbamazepine, warfarin and oral contraceptives, that has a known interaction can lead to various consequences. Avoid concurrent use of these drugs together to ensure a safe treatment. Next is the mechanism of action of tetracyclines. Firstly, tetracyclines bind reversibly to the 30S ribosomal subunit. It then inhibits bacterial protein synthesis process, thus preventing the binding of amino acid tRNA to the mRNA ribosome complex. The mechanism of drug resistance. The efflux pump expels the drug out of the cell, preventing the intracellular accumulation. Thus, prevent drug from binding to the ribosome. Result in the enzymatic inactivation of the drug, antibiotics. The pharmacokinetics of tetracyclines. Tetracyclines can be administered by mouth, PO, intramuscular, IM, or intravenous, IV. It metabolizes in the bile by the liver to form soluble glucuronides. And all the tetracyclines can be excreted in breast milk. Additionally, there are a few therapeutic indications of tetracyclines. Tetracyclines can be used for the treatment of mycoplasma pneumonia, rickettsial diseases, Lyme disease, cholera and acne. The contraindications of tetracyclines. Tetracyclines are contraindicated in pregnancy because of the risk of hepatotoxicity in the mother. Tetracyclines also contraindicated in renally impaired patients and patients with hepatic impairment. There are a few adverse effects associated with tetracycline. Tetracyclines can cause nausea, vomiting and diarrhea, dizziness and vertigo, photosensitivity, teeth discoloration and inhibition of bone growth in children. Lastly, the patient information. Patients who take tetracyclines must take the drug 1 hour before meals or 2 hours after meals with plenty amounts of water. Patients are also advised to not use outdated, expired, drug, as it may cause nephropathy.
Next is aminoglycosides, which is 2 amino sugars that are joined together by glycosidic linkage to a central hexose nucleus. Aminoglycosides are also considered as antibiotics that are only effective against gram-negative organism. This is because anaerobes lacks the oxygen-dependent transport system. There are several common drug names of aminoglycosides, which is neomycin, gentamicin, and amikacin. Avoid using these drugs with theraces, cytofovir, and streptozocin, as it can cause drug interaction. For their mechanism of action, antibiotic will bind irreversibly to 30's ribosomal subunit and distorting its structure. This action will inhibit the translocation of peptidyl tRNA that will cause mRNA misreading. The bacteria can't produce enzymes and proteins that are necessary for the growth and reproduction. Next is resistance mechanism for aminoglycosides. They occur through efflux pumps and also decrease the uptake into the cells. Furthermore, the modification and inactivation occur through plasmid-associated modifying enzymes. These drugs are primarily used to treat several diseases such as meningitis, pneumonia, skin, and mucus infections. In addition, it also can be used to treat tuberculosis, which is an infectious disease that most often affects the lungs and is caused by a type of bacteria. However, there are several adverse effects from using these drugs, such as ototoxicity, vertigo, auditory and vestibular damage. Most importantly, avoid using aminoglycosides with a patient with a renal impairment. Besides, never use these drugs with pregnant women as it can cause fetal harm that will affect its hearing. Other than that, combination of aminoglycosides with loop diuretic drugs may increase its ototoxicity. For the patient information, it is crucial for the patient to avoid touching their eyes in case of ophthalmic preparations. Besides, please refer or report to the doctor immediately if there are any dizziness or ringing in ears occur.
Macrolides are a class of drugs used to manage and treat various bacterial infections. Comprised of a lactone ring with a similar spectrum to penicillin, frequently used for infections in people who are allergic to penicillin. Azithromycin, clarithromycin, and erythromycin are commonly used drugs with their mechanism of action revolves around their ability to bind the bacterial 50S ribosomal subunit, causing the cessation of bacterial protein synthesis, and inhibit the translocation of peptidyl tRNA by preventing the enzyme peptidyl transferase from adding the subsequent amino acid attached to the tRNA. It interacts negatively with theophylline, oral anticoagulants, and cyclosporin. Its resistance mechanism is decreased uptake into the cells and presence of efflux pumps, decreased affinity of the 50S ribosomal subunit for the antibiotic, and presence of plasmid-associated erythromycin esterases in gram-negative organisms. Macrolides are used to treat Lyme disease or Borrelia infection spread through the bite of black-legged ticks, urethritis, chlamydia infection, lower respiratory tract infection, and pharyngitis, the inflammation of the mucous membranes oropharynx. Macrolides carry a certain level of risk such as epigastric distress aching that occurs in your upper abdominal region, cholestatic jaundice defined as stagnation in bile secretion and flow, and ototoxicity involving damage to your inner ear. The contraindications are hepatic dysfunction and pregnancy. Patient information of macrolides is to complete the prescribed course and refrigerate the drug after reconstitution.
Next, we have chloramphenicol. Chloramphenicol derived from Streptomyces and has an excellent activity against anaerobes. It also renowned as a broad-spectrum antibiotic. In FDA use and pregnancy rating, it's categorized as in Class C, which the risk of drug cannot be ruled out. This means that it's lacking in human studies and animal studies can be either lacking or risk positive where the potential benefits outweigh the potential risk. Chloramphenicol is also best avoided from using concurrently with drugs such as phenytoin, tolbutamide and warfarin as they increase the serum concentration. For the mechanism of action of chloramphenicol, it binds reversibly to bacterial 50S ribosomal subunit and inhibits protein synthesis at the peptidyl transferase reaction. It can be bactericidal or bacteriostatic, depends on the organism's type, but it is more commonly appear as bacteriostatic. The presence of plasmid-associated chloramphenicol acetyltransferase may cause a resistance mechanism of chloramphenicol. So, what kind of situation needed the use of chloramphenicol? Chloramphenicol can be used to treat rickettsia infection, bacteria conjunctivitis, serious hematological toxicity for systemic uses, meningitis for patients that are allergic to penicillin, and staphylococcal brain abscesses. No matter how good the drug is, it's still giving adverse effects to the consumer. Chloramphenicol may cause hypersensitivity reaction, gastric discomfort such as nausea, vomiting and diarrhea, or oral and vaginal candidiasis due to microflora alteration. Other than that, it may lead to anemia and gray baby syndrome, which is common among neonates due to undeveloped renal function. Hence, chloramphenicol is used with caution with newborn because it's concerned that gray baby syndrome may occur. One thing that the patient should be aware of is they must always wash hands when using chloramphenicol so the drug do not left on their hands. The last one is clindamycin. Clindamycin is useful for infection caused by penicillin-resistant staphylococci, anaerobic bacteria. It's categorized as B in FDA use and pregnancy rating, which no evidence or risk in humans. It is best avoided from using concurrently with drugs such as amiodarone, clarithromycin and itraconazole as they can increase effect of clindamycin. So, how is the mechanism of action clindamycin? Opposed to chloramphenicol before, clindamycin is inhibited by binding irreversibly to the 50S ribosomal subunit, thereby inhibiting translocation of peptidyl tRNA. Similar to chloramphenicol, it also can be either bactericidal or bacteriostatic depending on the organism. The last one is clindamycin. Clindamycin is useful for infection caused by penicillin-resistant staphylococci, anaerobic bacteria. It's categorized as B in FDA use and pregnancy rating, which no evidence or risk in humans. It is best avoided from using concurrently with drugs such as amiodarone, clarithromycin and itraconazole as they can increase effect of clindamycin. So, how is the mechanism of action clindamycin? Opposed to chloramphenicol before, Clindamycin is inhibited by binding irreversibly to the 50S ribosomal subunit, thereby inhibiting translocation of peptide ultrana. Similar to chloramphenicol, it also can be either bactericidal or bacteriostatic depending on the organism. We continue with the pharmacokinetics of clindamycin. Clindamycin is well absorbed following the oral administration, well distributed in all body fluid except CSF, cerebral spinal fluid, metabolized in the liver and excreted into the bile or in the urine by glomerular filtration. Clindamycin is known to treat respiratory infection, septicemia which is blood poisoning by bacteria, peritonitis which is inflammation of peritoneal, acne and bone infections. Adverse effects while taking clindamycin includes gastric discomfort, hypotension, urticaria, or also known as hives, and impaired liver functions. Clindamycin is contraindicated with patients who are hypersensitive with clindamycin and patients with liver function disorder. Patients should be informed not to skip doses and finish all medication as clindamycin is an antibiotic or the infection may occur again.